Thank you, Professor Waldemar Zacharasiewicz, for this kind invitation to be part of this artificial intelligence and human enhancement transatlantic dialogue. Also, thank you to Anna-Katharina Zalto for this amazing organization during our turbulent times. And I have to say thank you to the Austrian Academy of Sciences for sponsoring this event in the beautiful buildings and for allowing us to zoom in and be part of this vibrant conference in the heart of Vienna. Thank you also to the city of Vienna for co-sponsoring and allowing to host this event as well as being in the beautiful building of the Austrian Academy of Sciences. So I want to speak today about healthcare during this time of the pandemic. And I want to highlight artificial intelligence, robotics, and big data in healthcare in an empirical stakeholder analysis, and then present fresh data on an artificial intelligence healthcare index that are calculated all over the world. Artificial intelligence is this revolution and new technology, artificial algorithms and technologies that are human-like. And human beings are currently giving up decision-making power to machines that can act more rational than human beings. And this innovative technology is in most cases not very much regulated, as we are currently still going on in developing the potential of artificial intelligence. So what I did is I did a stakeholder survey in October 2019, an online questionnaire which was run over Qualtrics, and I emailed 17 experts who gave, or 17 experts gave responses to my email questionnaire, and overall they gave 395 free associations on artificial intelligence, robotics, and big data in healthcare. Then I categorized the data, and I just show you here as an example a category system with on the implications of the use of artificial intelligence, big data, and robotics in healthcare. And I created these categories. I just show you two categories and their associations along with it. And with this, I could draw these correspondence charts in which you see in the red dots, you see the different professions that gave responses, and the different categories of free associations. So here we see over the 17 experts that business, economics, and finance thought about privacy infringement risks of big data in healthcare and rising costs. Public and legal professionals also thought about this commodification of data. We all give up data that can be analyzed, and value can be retrieved from the data that we provide. The medical and healthcare sector thought about unpredictable risks that come along with artificial intelligence, robotics, and big data in healthcare, and but also the potential of assistance, but they were also cynical in terms of their job replacement risk and the problem of the compatibility of new technologies in healthcare. Safety risks came from academia and the education sector, but also the efficiency was highlighted. What I could also do with the free associations, I had a positive, negative, or neutral rating of the associations, and then I could create these polarity indexes. The more negative the index is, the more negative the associations were that in that area of investigation, and the more positive the emotional character was of the free associations. What you can see here is the risks are seen negative, the benefits positive. But what's really interesting is that the overall implications of the use of artificial intelligence and also the policy recommendations are seen as more positive, and the work experience so far is seen as quite positive. Correspondence charts on the benefits of artificial intelligence, robotics, and big data in healthcare reveal that the medical and healthcare profession think about the precision and the positive 24/7 availability of these novel technologies. Business, economics, and finance thinks there might be a better quality. It can be this potential of a human augmentation. The public and legal professions thought about the gene editing potential, so we can pick the most fertile genes, the genes that look the best and that have the best likelihood of being really fertile, and the broad applicability of artificial intelligence, robotics, and big data in health. What we can also say is that academia thought about the cost efficiency and the assistance that comes along with artificial intelligence, robotics, and big data. The large risks are seen as a manipulation, the complexity of these novel technologies, and discrimination. If I can make projections based on big data, how healthy you are, that can lead to a natural exclusion of certain categories. Business, economics, and finance thought about what about the human replacement in this artificial intelligence shock and the loss of humanness and the potential to errors, but also the public and legal professions thought about the health crediting pricing problems and justified price in inflation. Data leakage also seems to be on the minds of the experts. And academia and education thought about the data misuse and overconfident expectations. There might be ethical cliffs that arise from artificial intelligence, robotics, and big data in healthcare, and a natural dependence on these novel technologies. And we have to think about the ethical implications. And that's why we are thinking about currently also creating a policy framework and recommendations that come from the experts, account for thinking about ethics, the human control. Stakeholder inclusion is on the minds of business and economic sectors. Legal status is thought about in the healthcare profession, but also the driven innovation and the effects on the economy have to be integrated in the decision making. Academia and education again thinks about the efficiency, but also about data regulation and privacy protection needs and general risk management. The public and legal sectors think about equal access to healthcare and transparency issues and the effects of insurances. What will new technologies really bring in terms of insurances? Is the insurance premium going to rise with it? The overall work experience is seen as positive. Economics thinks about monitoring and surveillance, breaking down the complexity, risk management, but also advances in fintech are mentioned. Medical and healthcare sectors think about forecasting opportunities and consulting and decision-making support. The legal profession thinks about the big data creation and analytics, and the social entertainment sector online. Academia and education mentions the research and study opportunities that lie in big data. So overall, we can say that artificial intelligence, robotics, and big data have the advantages of being really effective, targeted aid. We can decentralize information sharing. You think about telemedicine, but there's also this risk of economic preponderance. Although we have this computational power and unprecedented big data storage capabilities, the technological advancements are enormous, and the economic growth potential of artificial intelligence we really see these days with the COVID-19 crisis, but we are also challenged in terms of figuring out how long should innovations last. What are we going to do if robots are starting to live next to us 24/7? When do we switch them off? There's this problem of big data misuse and commodification of our information that arises really democratic challenges. We have the risk of privacy infringements, dignity in information sharing should be enhanced, and the autonomy and security of humankind is at stake when you think of a new balance of power between humanness and artificial intelligence. That can lead not only to social stratification and hierarchies, but also to discrimination, especially when it comes to vulnerable, sick patients. The second part of my talk, I want to dedicate to brand new research, which I conducted on artificial intelligence, economic growth potential, healthcare, corruption, and market capitalization. So in all, I calculated 4 different indices in which I highlight different facets, how artificial intelligence and robotics and big data can be of value for healthcare over the entire world. So artificial intelligence first was shown from an economic productivity perspective, and corruption and healthcare were also faced in, and we can see a negative relation between corruption and good general healthcare. So the more corruption, the less money is there to really build up a positive healthcare system. And then lastly, I look into market financialization. Where do we have the financial power to fund artificial intelligence, robotics, and big data in healthcare? First, I calculated artificial intelligence by the proxy of internet connectivity and GDP. So here in this graph, over the entire world, you see the darker country is highlighted. The better internet connectivity is prevalent, hence the better artificial intelligence solutions are there, and the more economic growth potential we have. So we see especially Europe and the United States, but also Australia lead here. Then in the second index, I faced in corruption, because here you see first over the entire world, corruption is highly differently distributed all over the world. That's the Transparency International Corruption Perception Index. And the darker country, the more the people of the country think that the country is corrupt. Then I also took again this global connectivity index, where you see the darker the country is shaded, the more internet connectivity there is. And those are also the artificial intelligence hubs. So to this day, there's no single measurement of artificial intelligence development of a country. So you usually take internet connectivity as a good proxy for what's going on artificial intelligence, robotics, and big data being integrated into the workforce, into society. What I find first is a highly significant negative correlation between corruption and global connectivity. So the more free of a corruption the country is, the better globally connected it is. And this is not dependent on income. So it's not an income effect that simply rich places have no corruption and a good internet. There's no income effect, but there's a pure, highly significant correlation between corruption, freedom, and global connectivity. And that makes me feel good that artificial intelligence, robotics, and big data insights reaping happens in places that seem to be or are perceived by their people as less corrupt. Here you see over the entire world, the greener the country is, the less corrupt and the more globally connected. The redder the countries, the more corrupt and the less globally connected. Here you see it one more time mapped up. On the x-axis, you see the corruption perception. On the y, the global connectivity. And in the downwards right corner, you have here highlighted in yellow, you have these countries are the best leaders on less corruption and high connectivity. So you see the US, Switzerland, Singapore, Denmark, Finland, Norway, New Zealand, Australia, Canada, UK, Japan, Luxembourg, but also Austria here right in the middle. Those countries have the best leadership potential on corruption-free AI hubs that can have a leadership also in good healthcare and pandemic prevention. But how does this really relate to healthcare? In the third index, I face in the healthcare index, and I find first highly interesting, and this, I think, I've never seen anything on this, and I'm the first one to show it, that freedom from corruption is also correlated to good healthcare and positive internet connectivity. So that makes me even feel better that I know that those areas in the world that are free from corruption not only also are holding places where there's good internet connectivity, but also that internet and artificial intelligence solutions can be a vital transportation tool that is free from corruption, with which you can go all over the world. The internet doesn't have any borders or boundaries, so you can bring access to affordable Medicare that is corruption free via the tool of artificial intelligence, big data, and robotics into the entire world. Over the entire world, the greener the country, the more globally connected the country is, the better the healthcare is in this country, and the less corrupt the territory. The redder the country, the more corruption you have in a globally not connected place that also suffers from weak healthcare provision. And in the very last piece, I also look into who could fund artificial intelligence, robotics, and healthcare solutions in the world. I face in market innovation financialization via this NASDAQ Global AI Big Data Index. We see it's heavily funded in the US. 66% of that global fund are held in the US, then Japan, France, Taiwan, China, South Korea, India, Netherlands, Canada, Finland. We do have Germany, Israel, Norway, Ireland, Spain, and UK represented. And what this comes down to is the US holds such a high market financialization of artificial intelligence. It's completely green, and all the other countries are pretty much following in red. So you see the stark divide between so much capital in the US for artificial intelligence, healthcare, AI solutions. In the end, over all the macroeconomic indices and models, we can say that internet connectivity and high GDP are prevalent in Europe, Asia, and North America. Europe focuses especially on preventive Medicare, while the US has the most prosperous market financialization to advance medical innovations. Oceania, so Australia and New Zealand, performed very well on general healthcare. Asia and the Gulf region are in the middle ranges of healthcare, and Africa ranks quite low on healthcare and raising funds for AI solutions. But again, telemedicine opens the gates for access to affordable Medicare for everyone. So I hope there is potential to also lift and help countries catching up. And that's my last idea. Where should we go with this research? What's up next? COVID-19 is an external shock that really created innovative winning, but also losing industries that could not catch up with the digitalization and the disruption. So we have this heightened divide between financial markets and real economy, because financial market indices could jump quickly and replace in a portfolio losing industries with winning ones. But what we need is a reconnection of the finance market with the real economy, because the real economy is suffering these days from the economic fallout of the COVID-19 crisis. And what that means is that we should have a redistribution via taxation, big data gains, or virtual realities, and our online luxury worlds should be starting to be taxed. And in order for giving governments the financial means and the flexibility to offset digitalization disruption losses, but also to educate people how to deal with big data, how to share information conscientiously, and how to use virtual spaces responsible and with a good ethical climate. Healthcare revolutions are currently ongoing, especially in the US with the de-urbanization. So we see a large movement trend from metropolitan areas and large big cities where people cannot socially distance to suburbs and more it's a ruralization or de-urbanization. People move out in the wish to become more healthy, but also the workplace. There is this trend towards the selection of people who might be healthier, who can cope with COVID-19 better in the maintenance of the workforce. And here I want to really stop my transatlantic dialogue on artificial intelligence in healthcare solutions with two beautiful examples how Europe can lead with grand ideas, how to cut on the loss of being sick, and now with the COVID-19 disease, also seeing the losses, the stark losses, that you end up in a trajectory that's either positive or not so good, by two governmental tools. The one is the Präventionsgesetz, which comes out of Germany, where the German government said in 2015 they want to fund the industry, the private sector, in order to create space and information and access to trainings and good preventive medical care. So the government funds corporations that they incentivize their employees to take time off, to look after themselves, to learn more about themselves. And there's currently definitely a boom in preventive medical care and in the preventive medical care sector, especially with big data and self-tracking devices. The second large trend I see is also potentially taking up this Sozialpartnerschafts idea that comes out of Austria, really integrating different stakeholders from different communities in order to, as a community, create an environment that's healthy, that's conscientious, that has conscientiousness for intergenerational problems, that elder generations currently are more exposed to risks, and also in the conscientious, healthy, whole-rounded lifestyles that we hopefully all adopt and resuscitate during COVID-19. And with this, I finish it off with a big thank you for allowing me to be part of this fascinating conference. And I look forward to engaging with you all virtually in the next few days.